Hello everyone, today's lecture is about the congestive heart failure. So how do we define congestive heart failure? Congestive heart failure is defined as a condition in which the heart fails to pump blood at a rate required to meet the metabolic demands of the body's tissues. So what happens normally is that the left ventricle of the heart is pumping around 5 liters of blood to all the cells of the body, providing them with glucose and oxygen. The cells of the body use this glucose and oxygen in aerobic respiration to produce sufficient number of ATP in order to meet their metabolic demands. Now what happens in heart failure is that the volume of the blood pumped by the left ventricle in 1 minute, also known as the cardiac output, is decreased. So, less blood is transported to the cells of the body. As a result, less glucose and oxygen are supplied to the cells of the body, and cells are able to make less ATP. So, their metabolic demands are not met successfully. What could be the cause of decreased cardiac output in the setting of heart failure? There are two causes. Number one is systolic dysfunction, and number two is diastolic dysfunction. Let's discuss systolic dysfunction and diastolic dysfunction in detail. So, what is meant by systole? Systole means contraction. So, systolic dysfunction is basically the dysfunction of contraction. In systolic dysfunction, there is impaired left ventricular contractility. So, what happens is that the cardiac muscle within the left ventricle weakens, and the force of contraction or the contractility of the left ventricle is reduced. So, left ventricle is unable to pump sufficient blood into the aorta. We can say that left ventricle pumps less blood into the aorta. As a result, the cardiac output decreases, and what happens is that the left ventricle becomes overfilled with the blood and becomes dilated. So, in systolic dysfunction, you will find a dilated, overfilled left ventricle with weak cardiac muscle. So, there are a lot of causes of systolic dysfunction, and we will be discussing these causes in a separate video. Let's move towards diastolic dysfunction. What happens in diastolic dysfunction is that the left ventricle is stiff. The walls of the left ventricle are stiff, and the left ventricle is not able to relax properly. So, if the left ventricle is not able to relax properly, what will happen? It will not fill properly. There will be decreased filling of left ventricle, and if the left ventricle fills with less blood, so what will happen? The left ventricle will be able to eject less blood into the aorta, and as a result, the cardiac output will decrease. So, in the setting of diastolic dysfunction, you will see a stiff ventricle which is unable to relax completely to fill the blood. There are a lot of causes of diastolic dysfunction, and we will be discussing these causes in a separate video. Till now, we have discussed the heart failure. So, why is there a word of congestive in heart failure? Why the word congestive comes together with the heart failure? Because heart failure leads to congestion. Now, what is meant by congestion? Congestion is defined as increased blood within the blood vessels, right? So, what happens is that due to both systolic and diastolic dysfunction, there's decreased cardiac output, and decreased cardiac output causes the backup of blood in the left atrium. Obviously, there's decreased cardiac output, but the venous return to the heart is same. So, less blood is ejected out of the heart, and comparatively more blood is brought to the heart. So, the blood backs up in the left atrium, and as the blood backs up in the left atrium, it also backs up in the pulmonary vein, and the blood also backs up in the pulmonary capillaries, causing pulmonary congestion. Pulmonary congestion is when the blood capillaries or the pulmonary blood capillaries or the pulmonary veins are engorged with blood, they are dilated with blood. That is called pulmonary congestion, and this will cause the fluid to leak out of the pulmonary capillaries into the lungs, into the interstitium, and into the alveoli of the lungs, causing pulmonary edema as well. So, one of the signs of congestive heart failure is pulmonary edema, and this pulmonary edema will occur in cases of both systolic and diastolic dysfunction because the blood backs up in both the cases. So blood will back up in the left atrium, and then the blood will back up in the pulmonary vein, and then into the pulmonary capillaries, causing pulmonary congestion, and the fluid will leak out of the pulmonary capillaries into the alveoli of the lungs, causing pulmonary edema. So what happens is that in long term, the blood backs up in the pulmonary vasculature, and there's increased resistance within the pulmonary vasculature. There's increased pulmonary capillary resistance, or we can say there is increased resistance in the pulmonary arteries, right? So what happens is that the work of the right ventricle increases because there is increased resistance in the pulmonary vasculature. There is pulmonary hypertension, right? So because of that, the work of the right ventricle increases and the right ventricle fails as well. This will cause the backup of blood in the right atrium and then into the systemic veins like the inferior vena cava and the superior vena cava. Now this will cause generalized edema, specifically the edema in the feet that is known as the pedal edema, right? So that's why the word congestive together with the heart failure. So you should know that decreased cardiac output in the setting of heart failure also causes the sympathetic nervous system activation, and this will further worsen the congestion and edema. So before discussing the reason why increased sympathetic nervous system activation will further worsen the congestion and edema, before discussing that, we must discuss some background physiology. So there are a few basic concepts we need to discuss. Number one is the cardiac output. So how do we define cardiac output? We already discussed that cardiac output is the volume of the blood pumped by the left ventricle in 1 minute. And what is the formula of the cardiac output? Cardiac output is equals to stroke volume into heart rate. So how do we define stroke volume? Stroke volume is the volume of the blood pumped by the left ventricle in one heartbeat. So when the left ventricle contracts once in a single heartbeat, the volume of the blood ejected from the left ventricle into the aorta is known as the stroke volume. And how do we define heart rate? Heart rate is the number of times the heart beats per minute. So basically total volume ejected by the left ventricle in 1 minute, that is the cardiac output, will be stroke volume into heart rate, because stroke volume is the volume of the blood pumped by the left ventricle in one beat and heart rate is the number of beats in 1 minute. So we get the cardiac output, that is the volume of the blood in liters per minute. The other two concepts that we have to discuss are end diastolic volume and end systolic volume. So we all know that what is diastole and what is systole. Diastole is when the heart is relaxing or the left ventricle is relaxing, right? And systole is when the left ventricle is contracting, right? So when the left ventricle is relaxing, it is filling up with blood. And when this diastole ends, the left ventricle is completely filled with the blood. So volume of the blood in the left ventricle at the end of the diastole, when the diastole ends or when the relaxation of the left ventricle ends, the volume of the blood present in the left ventricle is known as the end diastolic volume. So what about end systolic volume? Obviously the left ventricle contracts and ejects the blood into the aorta and the blood leaves the left ventricle. So the volume of the blood in the left ventricle after the left ventricle contracts or at the end of the systole is known as the end systolic volume, right? So basically there's a diagrammatic illustration. This is end diastolic volume, which is found at the end of the relaxation or at the end of the diastole, and this is end systolic volume, which is found at the end of the contraction. Obviously end systolic volume is less than the end diastolic volume because when the left ventricle contracts, it forces out a particular volume of end diastolic volume into the aorta. So the remaining volume of blood that is left is end systolic volume. And we know that the volume of the blood that is ejected by the left ventricle in one beat is known as the stroke volume. So stroke volume can be calculated as end diastolic volume minus end systolic volume, because at the end of the diastole and just before systole, the volume of the blood found in the heart or found in the left ventricle is end diastolic volume. And what the left ventricle does, it ejects the blood into the aorta, and the volume of the blood that it ejects into the aorta is the stroke volume. So stroke volume is basically a part of end diastolic volume. And after the stroke volume is ejected, the volume of the blood remaining is end systolic volume. So stroke volume is equals to end diastolic volume minus end systolic volume. Okay, so next concept that we need to discuss is ejection fraction, and we define ejection fraction by the fraction of end diastolic volume. So basically it is a part of end diastolic volume, or the fraction of end diastolic volume that is ejected by the left ventricle into the aorta. So the fraction or the part of the end diastolic volume that is ejected by the left ventricle into the aorta is the ejection fraction. And how do we calculate the ejection fraction? Ejection fraction is obviously stroke volume divided by end diastolic volume, because we want to calculate the fraction. And stroke volume divided by end diastolic volume in 200 is known as the ejection fraction. So normal ejection fraction is greater than or equal to 55%. Then we need to discuss preload and afterload. So how do we define preload? Preload is the volume of the blood that fills the left ventricle during diastole. So what happens that the heart is loaded with blood, right? So the volume of the blood that loads into the left ventricle, or that is filled into the left ventricle during diastole, is the preload. So we can see over here that the preload is the volume of the blood that is being loaded into the left ventricle. In some books, the preload is defined as the extent of the stretch of cardiac muscle fibers. Obviously, the greater the blood that is loaded into the left ventricle, the greater will be the stretch on the cardiac muscle, because as the blood enters the left ventricle, the cardiac muscle fibers are stretched. So the higher the preload, the higher the volume of the blood that will fill into the left ventricle, and higher will be the extent of stretch. More muscle fibers will be stretched, or there will be more stretch to the muscle fibers. So preload determines, what factor determines the preload? Preload increases with increased venous return. So venous return is basically a factor which determines the preload. And what is venous return? The amount of the blood that returns to the heart through veins. So higher the venous return, if more blood returns to the heart through the veins, there will be more preload. How do we define afterload? Afterload is basically the resistance against which the left ventricle forces blood out into the aorta. So basically afterload is a resistance which the left ventricle faces when it pumps blood into the aorta. And afterload depends on what? It depends on peripheral vascular resistance. Now how do we define peripheral vascular resistance? It is basically the resistance of systemic arteries and the aorta to the flow of blood. And this resistance depends on what? This resistance depends on the diameter of the lumen of these arteries. If there is vasoconstriction or narrowing of the lumen of the arteries, there will be increased peripheral vascular resistance. And if there is vasodilation, that is the widening of the lumen of the arteries, there will be decreased peripheral vascular resistance. So what happens that afterload increases with increased peripheral vascular resistance. Obviously, if there is increased peripheral vascular resistance, there will be increased resistance to blood flow in the arteries. So left ventricle has to generate more force. Left ventricle will feel more resistance to pump the blood into the systemic arteries. So we can see over here, as the lumen decreases, that is by vasoconstriction, there is increased resistance to blood flow, or there is increased peripheral vascular resistance, and there will be increased afterload. Okay, the last physiological concept that we have to discuss is the rennin-angiotensin-aldosterone system. So what happens is that when the cardiac output decreases, the effective circulating blood volume decreases. Obviously, when the cardiac output is decreased, less blood is being pumped into the aorta and there is decreased effective circulating volume. So in that case, when there is decreased effective circulating volume, the blood pressure will decrease as well. So there will be low blood pressure. And when the blood pressure decreases, there is decreased renal perfusion. Now, what is meant by renal perfusion? The volume of the blood reaching the kidneys is the renal perfusion. So obviously, when there is low blood pressure, less volume of blood will reach the kidneys, and this will cause decreased renal perfusion. When the renal perfusion is decreased, so in response, the kidney secretes an hormone called rennin into the blood. And what rennin does, the rennin converts angiotensinogen coming from the liver into angiotensin 1. And then angiotensin 1 is converted to angiotensin 2 by angiotensin converting enzyme or ACE coming from the lungs. Right? So what angiotensin 2 does? Angiotensin 2 causes vasoconstriction, that is the narrowing of the lumen of the arteries, and this increases the blood pressure. So basically this is a response that when the blood pressure decreases, there will be a response to increase the blood pressure. So vasoconstriction increases the blood pressure, right? And what other thing is done by the angiotensin 2? Angiotensin 2 stimulates the release of aldosterone from adrenal glands. Adrenal glands are found at the top of the kidneys, and the aldosterone travels in blood and stimulates the kidneys to increase the salt and water retention. So there is more retention of sodium, or there is more reabsorption of sodium and water, and this increases the circulating blood volume, again increasing the blood pressure. So the effect of rennin-angiotensin-aldosterone system is to increase the blood pressure and to increase the circulating blood volume. Now, what is dangerous in heart failure is that the decreased cardiac output will cause increased circulating blood volume through rennin-angiotensin-aldosterone system, and this will further worsen the congestion. So let's move back to the flow chart. So what happens in heart failure is that there is decreased cardiac output, and obviously the body will compensate and will eventually increase the cardiac output back to normal. So let's see how this happens. So when the cardiac output decreases, there is decreased effective circulating volume. Obviously, when the cardiac output is decreased, less blood is pumped into the aorta and the effective circulating volume decreases. This causes the activation of rennin-angiotensin-aldosterone system and the release of antidiuretic hormone. Obviously, whenever the effective circulating volume decreases, antidiuretic hormone is released by the posterior pituitary gland. So both the activation of rennin-angiotensin-aldosterone system and increased antidiuretic hormone, because of both of these, the effective circulating volume will increase, and there will be increased venous return to the heart, that is preload. So there will be increased preload. And what happens when there will be increased preload? If more blood is returned to the heart, because the heart is unable to pump sufficient blood out of the heart. So if more blood reaches the heart and the cardiac output is low, this will further causes the pulmonary edema. This will worsen the pulmonary edema and peripheral edema. Because the heart is failing, the heart is not able to pump sufficient blood out, but more blood is returning to the heart. So there will be increased pulmonary edema and peripheral edema will worsen. So that is the problem actually. As I told you, that increased effective circulating volume due to activation of rennin-angiotensin-aldosterone system and antidiuretic hormone will further worsen the congestion and the edema. And we all know that as the cardiac output decreases and the effective circulating volume decreases, these both causes the activation of sympathetic nervous system. And when the sympathetic nervous system is activated, this causes vasoconstriction, and vasoconstriction increases the afterload. Obviously, when there is vasoconstriction, the left ventricle faces more resistance to pump blood into the aorta, and this can decrease the cardiac output, further worsening the congestion. But what happens that this effect is neutralized, or we can say that cardiac output is generally increased, because sympathetic nervous system activation also increases the heart rate, which will increase the cardiac output, and sympathetic nervous system activation also increases the contractility, which will increase the stroke volume. That is the volume of the blood pumped by the heart in one beat. Obviously, when contractility increases, stroke volume will increase, and this will increase the cardiac output. So basically, the effect of vasoconstriction is neutralized by increased heart rate and increased contractility. We can also say that not even neutralized, we can say that cardiac output is generally increased, and the heart failure is compensated. So that's it for this video. In the next video, we will be discussing the causes of different types of heart failure, or the different types of dysfunctions, like we discussed systolic dysfunction and diastolic dysfunction, right? So in the next video, we will be discussing the causes of systolic dysfunction and the diastolic dysfunction. Thank you so much for watching the video.